is not talked about enough.
Cervical cancer is a disease that affects the mouth of the womb. This disease is caused by human papillomavirus. The virus enters the cells of the mouth of the womb and cause changes. These changes are the precancers. The precancers, once not identified and treated early, they gradually change into cancer or a wound on the cervix, which is a cancerous wound. So let's look at the risk factors that can predispose women to cervical cancer. One of them is being at the age of 40 and you've never screened in your lifetime. Then early sexual intercourse. You've seen that girls get married in the community at a very young age, and their body structures are not yet mature enough. So you find that when they get HPV, that can predispose them to cervical cancer. Then we have multiple sexual partners. Women have many men engage in sexual partners with many men. You find that that predispose them to cervical cancer. Then delivering too many children at a very young age, where the cervix is traumatized on each delivery, and HPV can easily penetrate in the cervical cells and you end up with cervical cancer. Then not being screened in a lifetime, you find that some women have never screened, more especially in our communities. That can predispose them to cervical cancer because you'll never know if you have HPV or not unless if you go for screening. Then smoking and chewing tobacco or taking alcohol can also predispose you to cervical cancer. Then recurrent vaginal infections, if they are not treated and they injure the cervix and the vaginal mucosa, and then that can predispose you to cervical cancer. Then HIV and other related diseases that can lower somebody's immunity can predispose you to cervical cancer. Poor hygiene, like women don't even do wash their undergarments very well, they don't have soap and what have you, that can predispose them to cervical cancer. Use of vaginal herbs, and which can, when you look at the community, women insert herbs in their vagina most of the time, and these herbs, when they go to the garden, they just pick, they don't wash their hands, they squeeze and then insert in the vagina when they're in the gardens. So that one can also predispose you to cervical cancer. Another risk factor we are looking at is sharing undergarments. Like our young girls, you may find that in school they do share. They just share. If one of them is sexual active and has HPV, then these other girls can also get HPV and end up with cervical cancer.
My name is Vivian Kopsinger-Birchall, a producer and host for Healthcare Blind Spots. I hope that you will engage with our conversations, and if you want to be a part of the conversations, just write to me and we'll talk about cervical cancer.